Good morning. Welcome back to the OHSU Effect Inside Health and Science. We're going to talk about something that a lot of us can relate to, back pain. It's very common and it's caused by a variety of things. With me now on the OHSU Effect is Dr. Hans Carlson, an assistant professor of physical medicine and rehabilitation in the Department of Orthopedics. Good morning.
Good morning.
Okay, so what are the various causes of back pain?
There are multiple causes of back pain, and the treatment sometimes can be difficult because the first step is to figure out what the cause of back pain is. I generally try to divide back pain into two main categories. There's either a neurologic problem, something compressing a nerve like a disc herniation, or it's more mechanical pain. And patients will differentiate that because they'll describe more back pain or more leg pain, and leg pain usually is what we see with a pinched nerve, more of a sciatica.
And when you say mechanical, you mean something like poor ergonomics at work, poor posture, something like that?
When I think of mechanical, it can be anything else in or around the spine that can cause pain that's not a pinched nerve. So there's multiple structures in the spine that help the spine function and support the spine. And potential sources of pain for a more mechanical pain could be muscles, they could be ligaments, they could be the joints of the spine, they could be the discs of the spines themselves. But if they're not causing nerve compression, we won't have the neurologic symptoms. More commonly than not, we don't pin down the exact cause of mechanical pain. So that can be one of the frustrations as we try to treat back pain is we can rule out causes, but sometimes we still have to treat what's left over.
So everybody has back pain once in a while. At what point should we see a doctor?
You're correct. Back pain is very common, and for the most part, back pain is self-limited, meaning that someone will get an episode of back pain and it'll go away. Now, the timeline of that can be quite variable. Somebody may have 2 or 3 days where their back's bothering them. Somebody could have 2 months of back pain, and again, that can still be self-limited and go away. If back pain persists over a period of time, it's definitely worth seeing a physician for. If there's any neurologic type symptoms, so if the patient has numbness, tingling, weakness in an extremity, with some types of problems that can happen in the back, they may have more problems as far as neurologic problems. Further up the leg, they may have problems with bowel and bladder function. Those are things, anything neurologic needs to be seen by a physician, and generally right away. So if somebody's got new numbness, new weakness, new bowel or bladder problems, get to a physician right away for that.
So in referencing the more mechanical causes, like maybe a heavy lifting or a muscle strain, is there any home remedies that you would recommend before seeing a doctor?
Once some of the more significant problems are ruled out, most of the treatments, I think, can be done by the patient themselves as long as they know things to do for it. What we know across the board for the mechanical types of back pain, that activity is better than inactivity, and things like complete rest may feel good over the short term, but it allows muscles to stiffen, to tighten up, and weaken, and as people try to get active again, it's harder. So a lot of the home remedies are just stay active, do as much as you can with your normal activities, with some common sense. Don't go out and do things that are causing increased pain just because you feel like you should be active on it. Avoid things that tend to be unpredictable. But staying active is the best thing to do.
When you first see a patient, how do you assess the seriousness of the problem?
There's probably 3 steps to that. The first step is to hear what's going on with the patient. How did the symptoms start? What's the location of the symptoms? What triggers the symptoms on it? That by itself can often give us a very good idea of what the diagnosis is. The second step is a careful physical examination, and part of that is doing a good neurologic examination. Again, we want to find out if the patient has anything that may be one of these neurologic causes of back pain. And then, depending on what the history and the physical examination tells us, then we may need to do imaging, but oftentimes we can go ahead and treat without imaging.
Can a neurological problem be caused by heavy lifting or strain or something like that?
It certainly could. So again, when we think of neurologic problems, we think of some type of compression on nerve roots. And things that can do that are things like disc herniations, which can happen with heavy lifting or straining. But people can also have disc herniations from very benign routine activities. People can have disc herniations from things they wouldn't expect, as far as even sneezing, coughing, rolling over in bed. Sometimes a disc herniation can just be a random, spontaneous event. Having said all that, don't get the wrong idea. The back is a very tough, stable structure and can accommodate all types of activity. So, again, the overall message is that activity is good. Even sometimes physical activity can be good, but it's always good also to warm up and to not go from a cold, stiff position into very heavy physical activity.
Well, let's talk about treatment. Is back surgery always the answer?
Back surgery is the answer for specific things, but certainly not always the answer for back pain. As we mentioned earlier, many, if not most, episodes that people will have of back pain are just self-limited, and they can go away on their own for that. So we think of things for back surgery when we have a neurologic problem, where we have a nerve compression and a patient has neurologic symptoms, or they're losing function because of neurologic symptoms. They've got weakness that's getting worse. They have numbness, tingling, or other sensory deficits. That is one of the best reasons for back surgery, is to decompress the compressed nerves. When a patient has more mechanical symptoms, there's lots of things that the patient can do before they need to consider surgery. And sometimes surgery can be effective for the mechanical things as well. But again, there's lots of non-surgical treatments we can use for that.
Well, yeah. Well, let's talk about some therapy treatments. What are the goals there? What do you hope to see when people start therapy?
So I think the number one goal when we have a patient starting therapy for a back problem is to educate the patient on how they can manage their back symptoms. We want the patient to be somewhat independent and able to manage these things on their own. The treatments, if we go back to many episodes of back pain, are self-limited, then what we're doing with treatments are trying to keep the symptoms tolerable while the patient stays active and gets better on that. So some treatments can be things as simple as different medications over a short term that can help patients. When we get more into the functional aspects of that, then we utilize the physical therapists. And at the OHSU Spine Center, we have dedicated spine therapists. Again, if somebody's in an acute flare-up and we're trying to do whatever we can to get them active, some of those treatments may be things that we might think of more as just making them comfortable. But very shortly thereafter, what we want to do is get patients to start being active again. And some patients have had very chronic back pain, so it may take longer to get patients active and longer to educate them on what they can do and can't do, because they become very fearful of activity. So with the spine program, we work on very specific things. We want to have patients stronger with respect to their back muscles and their hip girdle muscles. We want to increase their flexibility. We want to increase their overall endurance. All these things help function. They also help the back.
And there's some minimally invasive treatments out there. Talk about those real quickly.
So as I think of treatments, I think of the therapies, and then we talked a little bit already about the surgeries. So there are some things in between, and they tend to fall more into what we'd think of as maybe more injection type things. So there are specific diagnoses that are amenable to different types of injections, which we also have specialists at the Spine Center that do. If somebody has a disc herniation and they're having leg symptoms, what we call sciatica, and it's quite uncomfortable, but they still have good neurologic function, they're not having weakness, sometimes instead of surgery, and what's called an epidural steroid injection may help, where anti-inflammatory medication is injected around the irritated nerve root. If these things can get better over time, and sometimes they do, if we can buy time by decreasing the inflammation, that can be helpful. For some mechanical causes of back pain, some other types of injections may be helpful. Injections into some of the joints of the spine what's difficult with those things is that they don't help everybody, and it can be hard to predict who they help and who they don't help. So patients will get a mixed message from friends or colleagues that have been through different types of treatments that have helped or haven't helped.
We're going to talk more about back pain with Dr. Hans Carlson in 5 minutes on the OHSU Effect.